So now we've come to the part of our webinar where we're going to get a chance to hear from someone who works directly with COD patients and who has 12 years of experience. I mentioned at the beginning who we would be talking with, but I want to introduce you. This is David Hernandez, who is a psychiatric substance abuse counselor at the New York Presbyterian Hospital Columbia Medical Center, and works with the patients that you may be working with as well all the time. And so I'm just going to ask some questions and really let David tell you from his long experience what will really be helpful and important about working with this population. So my first question, David, is COD as our topic. What is unique about COD in terms of the role of the social worker and those who were involved with the social worker in their treatment?
Well, COD is a population of mentally ill chemical abusers or individuals with co-occurring disorders that require a unique set of services from the social worker and other providers. In particular with the social worker, it could be from clinical to concrete services because these individuals comes with a lot more issues with regards to their mental health and substance abuse, and with that you have a lot of psychosocial matters that need to be addressed, and the social worker is a pivotal player in how those services and our treatment is provided and offered to them.
Okay. So you mentioned to me in our other conversations when we weren't on the webinar about the size of this population and some of the features of it. What's going on with the COD population nowadays?
Well, it's a growing population. I mean, you have now a lot more identification of this population as a underserved population. Most of these individuals are coming from environments such as the prison systems, the shelter systems, hospitals, and other community-based organizations that are identifying these individuals as not only having substance abuse problems, but also having a primary access one or mental health disorders. And they're being identified as individuals with co-occurring disorders. Mm-hmm. And their populations are growing exponentially throughout the city, throughout the state, and even throughout the nation.
Mm-hmm. And one of the things I think we also talked about before was some of the problems about the treatment of these patients that are different than treating either a mental health patient or a substance abusing patient.
Well, you're not only addressing one disorder, your psychiatric disorder, you're also addressing a behavioral disorder with the substance abuse. And when both of these are combined, you have a lot of issues relating to accessibility with regards to treatment and services. A lot of these services for the mentally ill chemical abusers or the co-occurring disorder client are fragmented. You know, so sometimes one patient could be asked, well, you know, we don't offer the psychiatric treatment here, you have to go to another facility. We have the substance abuse here, but we don't have the other services that you need. So they're fragmented, they're scattered, and that doesn't help in the continuity of care that you want for this individual. So that makes it very difficult for the social worker to treat and to help move this patient forward.